Hi, my name is Rusty Sudov, and I handed out a pamphlet with this QR code to this video just for some more information regarding diabetes. So I'm going to go over mostly that pamphlet just in more detail in this video. So thank you for looking, and hopefully you find some of this educational. So diabetes is also called diabetes mellitus. That's the medical term for it. And it's a term for several conditions involving how your body turns food into energy. When you have diabetes and don't get treatment, your body doesn't use insulin like it should. So too much glucose stays in your blood, and that's a condition that we usually call high blood sugar. This can cause health problems that may be serious or even life-threatening. The thing to know is that there's no cure for diabetes, but it's important to know that with treatment and lifestyle changes, you can live a long, healthy life. So I'm going to talk about some of those things in more detail here. So what can you do and where can you start? So that's where we're really going to start breaking some of these things down, especially that was on the pamphlet in a little bit more detail. So the first thing that we can do is choose healthy foods. And we normally call this a diabetic diet, but it's really just a healthy diet with fruits, vegetables, lean proteins, and whole grains. And really, when you go to the store and choose a food, just try to look at the labels on the back and um, try to get foods with the least amount of saturated fat as possible, and try to limit your carb intake because carbohydrates turn into sugar. So, and that's kind of what the next thing says is the sugar in your blood comes from certain foods called carbohydrates. So carbohydrates break down into sugar, which can cause high blood sugar. So foods that are high in carbs include candy and sweets, sodas, breads, tortillas, and white rice. So the more carbs you eat, the higher your blood sugar level would be. So try to choose more healthy foods. By doing this, will automatically most of the time help you with a more healthy weight. But eating the right foods will help you manage your blood sugar and keep it at the level that um, the physician will prefer, which is between 70 and 110. So the next thing is make physical activity part of your daily routine. Regular exercise can help prevent prediabetes and type 2 diabetes. It can help those who already have diabetes to maintain better blood sugar control. So sometimes newly diagnosed diabetics type 2, um, if there's a chance that if they eat the right, if they exercise, um, maintain a healthy lifestyle. There are times where people can go a long time without having to take medications, but it really does take a constant of choosing healthy foods and being active and checking your checking your blood sugar to see what it is. A minimum of 30 minutes of moderate exercise, such as brisk walking most days of the week, is recommended. Aim for at least 150 minutes of moderate aerobic activity a week. It's also a good idea to spend less time sitting still. Try to get up and move around. Try to be active for a few minutes at least every 30 minutes or so when you're awake. So, the next few things that we're going to talk about is kind of things that we need to look at as far as having diabetes. Some of the things that um, we look at with the disease process, and things that we probably didn't think about beforehand. So the first one is identify yourself. So I have a picture of this later on in the presentation, um, of like um, a bracelet that says that you are diabetic. So the reason we do this is because sometimes diabetics, when their sugar gets too low, it can cause them to become unconscious. So that's one reason that we tell you to maintain uh, your sugar, know what it is, try to keep something on you to keep it up when you feel shaky or sweaty or something like that when it gets low. This says keep a glucagon kit nearby in case of low blood sugar. You have a low blood sugar emergency. Um, so this is important, but it's also important when somebody finds you, they know, hey, this person's a diabetic, their sugar may be low, and that's the issue that they're having. So just make sure that you get a bracelet or something that says you're diabetic, some type of wristband that just so somebody knows. One thing you want to make sure to do is to schedule yearly physicals and regular eye exams. Your regular diabetes checkups aren't meant to replace yearly physicals or routine eye exams. Um, so for your eye exams, you have excess sugar running through your body. So this can cause issues with your eyes. So your eye specialist will want to check for signs of retinal damage, cataracts, glaucoma, things like that. You just want to make sure that you are getting a physical every year, so the doctor can look for any diabetes related complication and screen for any other issues that you may be having. It's really just a good practice to do that. Keep your vaccinations up to date. High blood sugar can weaken your immune system. So it's good practice to get the flu shot every year. And your doctor may recommend the pneumonia vaccine. It just depends on physician preference. Um, so the Centers for Disease Control and Prevention also recommends the hepatitis B vaccine if you haven't gotten it. All these are just recommendations for vaccines if you have diabetes, just because you have a weakened immune system due to the diabetes. Pay attention to your feet. This is something that's very important um, because with diabetes, like I said, you have excess sugar that's running through your body, so um, it it hinders blood flow and can keep your body from repairing itself, especially in the feet, in the lower extremities. So you want to wash your feet daily in lukewarm water, dry them gently, especially between the toes, moisturize with lotion, but not between the toes. And then check your feet every day for blisters, cuts, sores, redness, or swelling, and consult your doctor if you have a sore or other foot problems that doesn't heal promptly. You may have heard the term neuropathy. So that's something that diabetics can develop. Usually it's later on down the road, just depending on how well people have managed their diabetes. But this can cause, numbness, tingling, different things in the feet. And sometimes people won't even know that they have cut their foot or or their lower extremity. And it's not just in the feet, it can be anywhere, but it's mostly in the feet and lower extremities. But they won't even know that they've done this, and then it can cause more issues. It's harder to heal. So just something to be paying attention to. So the next thing is keeping your blood pressure and your cholesterol under control. So this is something that you can do really just with eating a healthier diet and exercising, but it's something that you just want to be aware of. Make sure you're going to your doctor's appointments. They can check these things. You just want to make sure that they're under control. Take care of your teeth. Diabetes may leave you prone to more serious gum infections. So just make sure that you're brushing and you're flossing your teeth. Um, Make sure you're going to regular dental exams. Um, you you can have a lot of different issues with not taking care of your teeth, including pneumonia. That bacteria that sits in your mouth can cause several problems. So just make sure to take care of your teeth, brush and floss. If you smoke or use other types of tobacco, just ask your doctor about ways that you can quit. Smoking increases your risk of various diabetes complications. Um, Smokers who have diabetes are more likely to have cardiovascular disease, more likely to have cardiovascular issues than non-smokers. So it can just cause other issues besides diabetes. There are ways to quit um, different things that doctors can prescribe you to help you with that. So that may just be one thing to look into. If you drink alcohol, do so responsibly. Alcohol can cause either high or low blood sugar, depending on how much you drink and if you eat at the same time. If you do choose to drink, do so in moderation. One drink a day for women and two drinks a day for men, and always with food. So remember, alcohol can just include a lot of carbohydrates. So if you're drinking a lot, remember that breaks down into sugar and can cause high blood sugar. So just remember that when drinking alcohol, try to do it responsibly. And then stress, take stress seriously. The hormones in your body may produce in response to prolonged stress may prevent insulin from working properly. So insulin is what you need to keep your blood sugar down. So if stress is causing it to not work properly, then your blood sugar is going to be high. So stress relief in different type of ways, relaxation techniques, plenty of sleep. Sometimes a lot of people, um, exercises and healthy eating really helps. So there's a lot of different ways to help with this, but just make sure you're taking it seriously. So a lot of these things are things I've already talked about, but the main one I've really wanted to show in this one is the bottom left. And this is a diabetes bracelet, and not all of them look like this. There can be different ones, but this is something that diabetics wear sometimes. And you see the one under it says "See wallet card." Some people carry a card that says they're diabetic. These are really just um, for people to know if they find somebody unresponsive, then they know they need some glucagon or some type of sugar. So they just want to be sure that you know what that looks like, just in case you do decide to do that. Not everybody does that, but a lot of people do. So these other things are just making sure you go into the doctor, foot care, eye doctor, making sure you're up to date on your vaccines, um, trying to stop smoking, and just techniques for helping with stress. So some of these are the signs and symptoms of high and low blood sugar. So for low blood sugar, which is called hypoglycemia, um, it has to do with sweating, clammy, confusion, lightheadedness, tremors, double vision. All of these symptoms vary. Also the number varies. Some people may get these symptoms at 40. Some may get them at 100. Some may get them at 20. It's really just depends on everybody's different. But these are the signs if you're sweating and you're real lethargic, don't really have any energy. It's a good idea to check your blood sugar. Make sure it's not too low. If it is, you may want to eat what we call a simple carb. So remember, carbs break down into sugar. So something like this would be hard candy, honey, crackers, graham crackers, fruit juice, something like that. You want to do that at first just to get it up. And just give it a few minutes, but you definitely want to drink some type of apple juice is really good, orange juice, some of these things to kind of get it up a little bit. And then make sure you may want to adjust your medicine, or talk to your doctor, let them know that it's dropping real low, and they can adjust it. Um, so signs of high blood sugar or hyperglycemia is, we have these fancy names, but really it's excessive hunger or increased appetite. So if you're eating a lot, or uh, can't help but just want to eat, um, excessive thirst, or just drinking a lot, um, can't get enough to drink, whether it's water or anything, really dry mouth. This may be a sign. And then if you're having to go to the bathroom a lot, if you're, what you've been drinking, but, usually, but if you're just going to the bathroom and going to the bathroom, if you just can't stay out, this may also be a sign that you have high blood sugar. So just be aware of these, because you do want to check your blood sugar. Um, and I think I said it in the next one. Yes, monitor your blood sugar. So before meals, usually if you want to, after meals, 3 to 4 times a day is um, a good rule. Really, you just want to make sure if it's been high, if it's been running low, you may want to check it more than normal. Um, so it's really just up to you, but you just want to make sure that you are checking it. Um, and you want to make sure that your target range is between 70 and 110. Um, those numbers may vary. They change periodically. 70 to 120. You don't want it under 70. And it just depends on what your doctor puts as for a range. But just for now, we'll say 70 to 110. So some of the resources that I've put in here, the first one is the health department in Lee County. Put this in for people that have Medicaid. They can receive free monitoring equipment, like a glucometer, which checks your sugar. You may could get the strips, and some of the things that go with that. So this is a really big resource. You can also get some vaccines there. It just depends on which ones. But there's nurses that work there, and they can talk to you directly and help you, and make sure you get what you need. So the last slide that I have, and this is just a list of local primary care physicians. Um, you want to make sure you have somebody that you're going to see. They'll check your blood pressure, your blood sugar. They'll probably check your A1C, which is like a 3-month look at how well your blood sugar has been maintained or cared for. See if they need to change any medications. Make sure everything's going good and that you don't need anything. It's really good to have a primary care physician to keep a check on you, to kind of make sure that everything's going well, that they don't need to change anything, and they'll tell you how often you need to come. Um, so this is just a list to kind of help with that. It's not one or two, it's about 10 or 12. Um, so just make sure to find one and find one that you like, and just make sure that you're going to your primary physician, when scheduled. So I hope this was educational. I hope that you learned something from this. And please let me know. And thank you for your time.